Hello and a warm welcome to South Asia Today, where we bring you in-depth insights into the key events shaping South Asia. I'm Shivangi Mishra, and now today's top stories. Turning childhood dreams into flying machines and future technologies in India. Sri Lanka's health system under pressure as dengue cases surge. And Pakistan accused of using family coercion to silence Baloch leaders. Let's begin the show. Big dreams don't always need big beginnings. In Ranchi, a group of young innovators is proving that passion, creativity, and perseverance can turn limited resources into limitless possibilities. What began in a small room has evolved into an inspiring journey of aero modeling and drone innovation, demonstrating how determination and imagination can help young minds soar to new heights.
At first glance, it looks like a real aircraft soaring through the sky, complete with intricate details and a lifelike design. But this is not a full-sized airplane. It's an aero model built by Ranchi's Santosh Ram and his friends. What began as a passion for learning, experimenting and creating something new has now taken flight, transforming a small room into a hub of innovation and dreams. From the outside, the room may seem ordinary, but inside, every model hanging on the walls tells a story of perseverance and creativity. Despite limited resources, Santosh never lacked determination. Through self-learning and countless experiments, he mastered the art of aero modeling. Over the years, his skills have grown remarkably, and today he builds models capable of actual flight. His work has earned him recognition across the city, and along with his friends, he regularly showcases his creations at science exhibitions and government events.
मुझे छोटे प्लेन बनाना और उड़ाना बहुत ही पसंद है। मैं जब स्कूल में था तब से ही मुझे लगता था कि कुछ अच्छा बनाना है, कुछ अलग बनाना है। तब से मैं छोटा छोटा एयरक्राफ्ट बनाना स्टार्ट किया, लेकिन स्टार्टिंग में मुझे बहुत कुछ सामना करना पड़ता था, उड़ नहीं पाता था प्लेन। मैंने उस पर बहुत कुछ ऐड करते गया, उस प्लेन को बनाते गया, उस पर बहुत सारा इलेक्ट्रॉनिक सामान लगाते गया। उसके बाद फिर मेरा प्लेन फ्लाइंग होना स्टार्ट हुआ।
Every aero model crafted by Santosh reflects his technical skills, creativity and relentless dedication. Having mastered the art of aero modeling, he and his team are now exploring advanced drone technology and pushing the boundaries of innovation. Inspired by his passion and vision, many of his friends have joined this journey, turning their free time into an opportunity to learn, create and innovate together.
मुलाकात संतोष से बहुत पहले हुआ था, जब मैं स्कूल टाइम से ही हम दोनों साथ में पढ़ाई करते थे। तो मुझे नहीं पता था कि इससे कुछ बनाने का शौक़ है, कुछ उड़ाने का शौक़ है। बस बात चलता था कि कुछ करना है, कि चार पंखों वाला एक ड्रोन होता है, तो बना के लोगों को दिखाना है और साथ में उसको फ्लाइंग कराना है। तो मैंने भी बोला कि चलो ट्राई करते हैं भाई। सपना एक रहता है कि उसको पूरा करने में ज़्यादा अच्छा लगेगा।
Santosh's journey has been shaped by the unwavering support of his family. After losing his father at a young age, his mother and elder brother became his strongest pillars of support. Despite growing up in a small town, he dared to dream big. Today, his achievements are a source of immense pride for his family, especially his mother.
ये 7 क्लास के आखन से ये सब करते रहा, आते रहा, बनाते रहा, अपना अपना कुछ कुछ प्रोजेक्ट सब मिलता था, वो सब बनाता था, दिखाता था। तो वही सब में आगे बढ़ते गया, सीखते गया। फिर एक दिन तैयार किया, तब मम्मी हम ये चीज़ बनाए हैं कह के बताया, उड़ा करके दिखाया, देखे सब कोई बाहर में मिल के। तो हमको भी अच्छा लगा कि चलो मेरा बेटा आगे बढ़ रहा है।
Santosh's story is more than a hobby. It is a testament to the power of dreams, determination and innovation. It shows how young minds from small towns are breaking barriers and aiming higher than ever before. With little more than a small room, a group of friends, and an unwavering passion to create, they are proving that great ideas can take flight from anywhere and inspire a brighter future.
Moving on, a sharp rise in dengue infections is putting Sri Lanka's public health infrastructure to the test. With tens of thousands infected and hospitals witnessing a steady influx of patients, authorities are scrambling to contain the outbreak through nationwide prevention campaigns. The crisis is raising fresh concerns about urban sanitation, disease surveillance, and the country's preparedness for recurring public health emergencies. We have this report.
Sri Lanka is facing its worst dengue outbreak in years, with more than 44,000 cases and 28 deaths reported since the beginning of 2026. The mosquito-borne disease has spread rapidly across the island nation, increasing the burden on public hospitals and healthcare workers. Health officials say a combination of changing weather patterns, unplanned urbanization, and environmental damage caused by Cyclone Ditwa has contributed to the surge. Dengue, a seasonal threat during Sri Lanka's monsoon months, has returned with unusual intensity this year. Official data shows infections nearly doubled from around 5,600 cases in April to over 10,600 cases in the first half of June alone, signaling a worsening public health challenge.
Sri Lanka is a tropical country. There are cases throughout the years, and we had a largest outbreak in 2017. Then after that 2019, and there's a surge in 2023 also. But last year, the Ditwa cyclone, we see a higher number of cases than previously. For this year, our baseline was high in January also. So due to this weather pattern, in intermittent raining pattern, and a higher number of waste in environment may have caused this outbreak.
The growing caseload is exposing pressure points within Sri Lanka's health infrastructure. Public hospitals in several districts are dealing with increased admissions, while health authorities warn that infections are likely to continue rising in the coming weeks.
The source reduction campaign, environment modification, those campaigns with the fogging for mosquitoes, those are the things mainly done at the grassroots level with the help of local governments and district secretariats.
The outbreak underscores the importance of robust public health infrastructure, from waste management and drainage systems to disease surveillance and community outreach. While emergency measures are underway, health experts say long-term investment in preventive healthcare will be crucial to reducing Sri Lanka's vulnerability to future dengue outbreaks.
Now we take a look at some happenings in Asia in a segment called Asia Watch.
Energy ministers and delegates from BRICS member nations met in Gurugram to strengthen cooperation in the energy sector, with a focus on smart grids, energy storage, and clean energy transition. Union Power Minister Manohar Lal Khattar announced the launch of the BRICS Digital Center of Excellence on Smart Grid and Energy Storage. The platform aims to promote innovation, knowledge exchange, and collaboration in building resilient, sustainable, and future-ready energy systems across BRICS countries. Qatari Prime Minister Mohammed bin Abdulrahman Al Thani met Haytham bin Tariq in Muscat for talks amid ongoing regional diplomatic consultations. According to reports, discussions are linked to proposed negotiations involving Iran, Iraq, and Gulf Arab states on the future management of navigation and maritime services in the Strait of Hormuz. The meeting underscores continued efforts to enhance regional dialogue and cooperation on maritime and security issues. Canadian Defence Minister David McGuinty said Canada is closely monitoring the Global Combat Air Program, GCAP, a next-generation fighter jet initiative led by Japan, Britain, and Italy. Following talks with Japanese Defense Minister Shinjiro Koizumi, McGinty described the program as a promising initiative and said Canada is interested in learning more about potential opportunities for cooperation, research, and technological collaboration.
For years, Balochistan has witnessed allegations of enforced disappearances, arbitrary detentions, and crackdowns on political dissent. Baloch activists have repeatedly accused Pakistani authorities of targeting not just political leaders but also their families. In an interview, Baloch political activist Hakeem Vadela alleged that Pakistan is using pressure tactics against relatives of prominent Baloch leaders to silence dissent and weaken the Baloch national movement.
Balochistan, Pakistan's largest yet least populated province, has long witnessed a cycle of unrest with nationalist groups accusing the state of political repression and systematic human rights violations. For years, Baloch activists have alleged that enforced disappearances, extrajudicial detentions, and intimidation have become common tools used to curb demands for political rights and greater autonomy. The issue has repeatedly attracted international attention, with families of missing persons staging protests and rights organizations raising concerns over the treatment of political dissidents in the region. Adding to these concerns, London-based Baloch political activist Hakeem Vadela has leveled serious allegations against Pakistani authorities, accusing them of using family members of political leaders to undermine the Baloch national movement. In a video statement, Hakeem claimed that members of Dr. Naseem Baloch's family were compelled to participate in what he described as a staged press conference and were forced to repeat allegations that align with the state's narrative against Baloch political activists and leaders. According to him, Naseem Baloch's father and two uncles were allegedly detained by Pakistani security forces in February 2026 and remain in custody at undisclosed locations.
On 22nd of June 2026, family members of Dr. Naseem Baloch were forced in a staged press conference to disown any relationships with Dr. Naseem Baloch. They were also forced to use fabricated allegations against him, which is a state narrative which they've been using against the Baloch political activists and leaders. As we all know that Dr. Naseem Baloch's father and two of his uncles have been abducted by the Pakistani forces in February 2026 and are still under the custody of the Pakistani forces in unknown location.
Vadela's alleged that Dr. Naseem Baloch's relatives were pressured into speaking against him in a bid to tarnish the prominent Baloch voice. Describing it as a cowardly tactic, Vadela accused Pakistan of using collective punishment to silence dissent by targeting activist families.
This action, this cowardice action, I would call it, of Pakistani state is what the Baloch national movement have been calling out as the collective punishment, which is used against the family members of the Baloch political activists and leaders to suppress their voices in Balochistan. But as we have been witnessing this policy has never worked. It will not work now. It will not work in future. Our request, our urge from the civilized people and the world is to take action of this brutality of the Pakistani forces.
The activist further highlighted what he described as a recurring practice in which families of missing persons, political activists and members of the Baloch resistance are allegedly forced to publicly denounce their loved ones under pressure. As fresh allegations emerge from Balochistan, questions continue to mount over Pakistan's human rights record. Activists argue that targeting families to silence dissent reflects a deeper crisis of accountability. With international scrutiny growing, calls are intensifying for transparency, justice and protection of fundamental rights in the troubled region.
Bringing quality healthcare closer to underserved communities, advanced medical facilities are helping bridge the healthcare gap in Rajouri's remote villages. Through the introduction of modern medical technology and specialist consultations, quality treatment is now reaching some of the district's most underserved communities. The initiative is proving to be a major relief for poor patients, reducing the need for long-distance travel and ensuring timely medical care in hilly and inaccessible areas. Let's have a look.
In a significant step towards strengthening healthcare access in remote and underserved regions, Rajouri district has witnessed the establishment of 3 telemedicine consultation units at Badhal in block Khavas, Dharsakri and Nadiala Bagla. The initiative is set to bridge the healthcare gap for residents living in some of district's most isolated and hilly areas. By leveraging digital technology, these centers will connect patients with medical experts, ensuring timely consultations, improved diagnosis, and quality healthcare services closer to their homes.
हमारा जो एक ई संजीवनी प्रोग्राम है वो ऑलरेडी हमारा एक जस्ट लाइक टेली कंसल्टेशन ही है. हम ऑनलाइन जो सर्विसेज है वो हम दे रहे हैं अंडर हमारा एक नेशनल प्रोग्राम है ई संजीवनी का. तो ई संजीवनी में हम अपने पूरे डिस्ट्रिक्ट में 94 इंस्टीट्यूशंस पे जितने भी आयुष्मान आरोग्य मंदिर है 94, वहाँ से ऑलरेडी हम ये टेली कंसल्टेशन जो सर्विस है पेशेंट्स को वो ऑलरेडी इन 94 इंस्टीट्यूशंस पे हम जो ऑलरेडी दे रहे हैं. हमारा जो टारगेट था इसमें जो लास्ट ईयर का हमें टारगेट था, क्योंकि इसमें हमें रहता है कि हमें कितनी कंसल्टेशन जो है पर ईयर देनी है, तो हमें इसमें 26,450 जो हमें पेशेंट का या कॉल्स का जो टारगेट था लास्ट ईयर का, लेकिन हम J&K में सबसे राजौरी टॉप है और हमने 65,327 जो 26,000 के टारगेट के अगेंस्ट हमने 65,327 जो पेशेंट्स देखे जो कॉलें लगाई और जिनको हमने ये ई संजीवनी जो हमें ऑनलाइन टेली कंसल्टेशन जो सर्विसेज थी वो हमारी डिस्ट्रिक्ट में हमारी टीम ने दी.
Equipped with state-of-the-art digital diagnostic equipment, each telemedicine unit can conduct nearly 19 different health examinations and vital parameter tests, bringing comprehensive healthcare services closer to communities in remote areas. The facilities spare patients the burden of traveling long distances for routine checkups and consultations. Through an integrated digital platform, residents can connect with specialist doctors in fields such as gynecology, cardiology, pediatrics and surgery, receiving expert medical guidance and treatment recommendations from comfort of their local health center.
यहाँ प्रॉपर्ली चेकअप ऐसा होता है कि यहाँ टेस्ट किए जाते हैं सारे. टेस्ट होने के बाद जितने भी जितने टेस्ट उसके होते हैं वहाँ डॉक्टर एक बैठता है, ऑनलाइन डॉक्टर चेकअप कराते हैं उसको. जब पेशेंट यहाँ उनके पास आता है उसके पूरे टेस्ट होते हैं, यहाँ टेस्टिंग की जाती है. उसके बाद ये हमारा डॉक्टर जो बैठता है उससे उनको डायरेक्ट वीडियो कॉलिंग पर उनसे मिलाते हैं. ये तो जो भी प्रॉब्लम होती है वो टेस्ट वहाँ देखते हैं, देखने के बाद वो दवाई वहाँ से लिख देते हैं, तो यहाँ दवाई मिल जाती है पेशेंट को. मैं लोगों को बहुत बेनिफिट है इसका. ये मशीन देखो सब टेस्ट हो जाते हैं यहाँ से रजौरी जाकर लोगों को टेस्ट कराने पड़ते थे. जो टेस्ट यहाँ होते हैं वो रजौरी जाकर लोग कराते हैं टेस्ट, लेकिन यहाँ बडाल में टेस्ट हो जाते हैं वो.
The telemedicine units have been strategically set up in some of Rajouri's most remote and difficult terrains, bringing much needed healthcare services closer to communities that have long struggled with limited medical and transport facilities. The initiative is emerging as a lifeline for economically weaker families, senior citizens, women and patients who often face hardships in reaching major hospitals for treatment. Established at a cost of nearly 40 lakh rupees each, the centers offer free diagnostic tests, specialist consultations and medicines, ensuring accessible and affordable healthcare for all.
इसमें टेस्ट होते हैं, शुगर का होता है, बीपी होता है और भी 19 टेस्ट होते हैं. इसमें सारे फ्री ऑफ कॉस्ट होते हैं. यहाँ गाइनिंग के डॉक्टर से भी हम इन लेडीज़ को मिलवा सकते हैं. लेडीज़ को सफ़र नहीं करना पड़ता. पहले यहाँ से रजौरी जाना पड़ता था, बकोरी जाना पड़ता था. अब यहाँ इनको हम ऑनलाइन डॉक्टर से मिलवाते हैं. जो भी डॉक्टर मेडिसिन वहाँ से लिखते हैं हम इनको सब इधर से प्रोवाइड करते हैं. बच्चों के डॉक्टर भी यहाँ बैठते हैं, मेडिसिन के भी बैठते हैं, स्किन के भी सारे डॉक्टर बैठते हैं और अच्छे से लोगों को देखते हैं और हम अच्छे से इनको दवाई वगैरह इधर से दे देते हैं। जब वो उधर से लिख के देते हैं, ऑनलाइन सब ऑनलाइन होता है सिस्टम।
The telemedicine initiative is fast emerging as a lifeline for residents of Rajouri's remote and hilly villages, reflecting the Jammu and Kashmir administration's commitment to extending essential services to every corner of the region. By bringing specialist healthcare closer to communities that once faced long and difficult journeys for medical attention, the project is transforming access to quality treatment. It stands as a significant welfare-driven effort aimed at improving public health, reducing hardships, and ensuring that even the most far-flung areas are not left behind in the journey of development.
As we wrap up today's episode of South Asia Today, we thank you for joining us. We'll return next week at the same time with more insights and updates. This is Shivangi Mishra signing off on behalf of our entire team. Until then, stay safe and goodbye.